We have a live studio audience here. You recently moved to Florence, Italy. Talk about your practice there and what you're focusing on and what patients can expect from you.
Yeah, I mean, I'm Italian myself, so I was born in Genoa, which is northwest of Italy on the coast, and I moved to the UK in 2016 when I was 31. Now I come back to Italy when I'm 40, so 9 years later. And actually, what I liked from the UK is like there's a very good team approach to the pathology, which of course enriches a lot your own skills, but especially your own knowledge of the pathologies. At the same time, what I didn't like really, I couldn't build something which was meaningful to me, essentially, because everyone, I don't know if someone is from the UK, but you have these consultants work independently in a way. So everyone is in charge of his patient or patients. And I think that it's a bit of a difficulty sometimes if you want to push the boundary, if you think about something different, because all the other, you don't have someone who really dictates a clinical way. So it's like, okay, let's do this way and off. No, because everyone has his own voice. Everyone can decide for his patient or her patient, and everyone is the same. So this is something that sometimes I really struggle with. Because of course, for example, you have someone and you listen to the story, you say, God, this guy needs some treatment because, and they say, no, that's too dangerous or too, and actually, I mean, like if you do some stuff every day, if you are a painter, if you are like, I mean, let's say they are a circus entertainer, you jump on the rope, and if I do or if you do, then of course we're going to jump out of the rope and we're going to break our head and we say, oh, that's dangerous. But if if you every day do the rope and you have some skills, then at the end of the day, you won't jump out from the rope, or if you fall, then you will minimal damage, or most of the times. So that's more or less.
Thanks. I'm good.
Whoops,
yeah, that's more or less what I yeah, it's Joyce. But it's more or less what I felt like I want to move back to Italy, where there's more clinical leadership. Of course, it depends on who's the clinical leader, but I found myself very happy in this place where they actually value my input, that I'm the point of reference for all the P.A.D. lower limbs patients, and actually there are lots of people who are willing to learn, and it's kind of a very good feeling with in a complete different culture and environment, and I really love it. So also, in between the other things, I'm going to start also my training in open vascular surgery.
Wow, that's amazing.
As interventional radiologist, I'm in what I can offer. Yeah. So in November, alongside my job, I will start also the open surgical training, which is something that I always wanted to do, because I feel that, of course, you can fix most of the stuff endo. But today, for example, I had a case which was like complete madness, with a reconstitution, is a CLI patient with reconstitution at the level of the tibial vessels. And I said, they're super small. I said, whatever I do, I will destroy this landing zone. I will damage these vessels. So I said, okay, despite I'm very pro endo, I said, okay, I will stop. I discussed with my colleagues, I'm going to perform a bypass there. Because 1/50, 60 really deserves a bypass. And I didn't want to end up being the guy who only can move a guide wires and catheters. I want to be the guy who can take care of lower limbs, in different ways. So at some stage I say, okay, I will offer you the best option, what I think is the best option for you. Because to be honest with you, the case of today, the best option was surgery. She had a vein. So the best option for her was bypass. And, of course, I work in a team, so I was able to call colleagues and discuss the case, and someone else will give her this option. But in the future, in the next 5 years, I want to be the guy who can give all the options to my patients. So yeah, that's also the meaning of coming back to Italy.
Yeah, it just speaks volumes for your character and your commitment, to patients and ensuring that they have the best quality treatment to have a better quality of life.